All right, well, I think we can get started. We'll let people keep rolling in while we're going through our intro, but I think we can kick it off. So, happy Thursday, good barely afternoon, everyone. Welcome to IPHA's third Thursday Lunch and Learn web series, organized by the IPHA Education Committee. We dedicate this time every month to sharing some of the successes and some of the detours that it might take to get to those successes as well, because those can help us grow too. The point is to connect, learn, and strengthen the voice for public health in Iowa, which of course is the mission of IPHA. If you're a member of IPHA already, we thank you for that. If you're not yet a member, we invite you to join us and help us carry out our mission. You can do that on our website at iowapha.org. Today we're talking to Audrey Tran Lam from the University of Northern Iowa, who's going to share about the Farming for Public Health initiative and how it addresses both environmental and human health in Iowa. But before we get into that, just a couple housekeeping items. Your microphone should be muted and your video off, because that just helps us keep as much bandwidth as possible, so that we can see and hear the presenter as well as possible. But you can put your questions in the chat or the Q&A features here on Zoom. So now I'll turn it over to Audrey. She can introduce herself and talk to you all about farming for public health. Audrey?
Thanks, Brett. Hi, everyone. Good afternoon. Thank you so much, Brett and Lena, for the invitation. I am admittedly a little nervous. I'm very excited to be able to talk about some of my work to this audience in particular. Let me see if I can get my screen going here, and I'll look for a wave from Brett saying that it's sharing correctly. Cool. When I give this presentation, this a version of this presentation, I really love to sort of throw the disclaimer out there that I actually love getting interrupted when I'm giving presentations. You know, if you have a question or a comment or need some clarification, I don't know if it's kosher for these lunch and learns to unmute and go ahead and ask, but you know, wave a hand to Brett or shoot something in the chat so that I can stop and elaborate on it. I'd be happy to. Let me see.
Yeah,
Also,
I said everyone's unmuted. I'm actually not entirely positive if they have the ability to unmute. If you do, go for it.
Okay.
If you don't, throw it in the chat and I'll read your question out.
Awesome. Thanks, Brett. Can you see my cursor? I'm going to be pointing to things in my presentation, and I can't access my presentation mode to get the laser pointer. Okay, great. So my name is Audrey Tran Lam. I work at the University of Northern Iowa Center for Energy and Environmental Education. I graduated in 2017 from the College of Public Health at the University of Iowa. I was in the Occupational and Environmental Health Department. And let me tell you, there weren't a lot of OEH MPHs out there. So I feel like I'm in a world all my own sometimes when I talk about some of this content as it relates to public health. But I've had the pleasure to serve as the Environmental Health Program Director at the CEEE since late 2017, where we really talk about the overlap of human health and ecological sustainability. And this particular initiative, Farming for Public Health, is something that I'm especially excited about. But I will be really going over a lot of the context for why this program exists and what it is that we hope to educate folks on and achieve through it. Okay. So, I did say I was a little bit nervous to be giving this talk, but also speaking to other public health professionals is kind of my comfort zone. I feel like we speak the same language. We're trained to be systems thinkers, and we prioritize upstream solutions, which is how, like, the lay person example I always give is we are focused on turning off the faucet before we have to mop up the floor, right? This is sort of what public health is, but applied to human health and, populations. The objectives for this presentation is to, at the end, you'll have a good picture of what the Farming for Public Health initiative is, but really focusing on how agriculture in Iowa and public health relate to one another, and give you a glimpse into some of the land-based solutions that address environmental and human health. So what are these win-win, or I think, as Lena put it in her messaging that went out, yield solutions for health and agriculture? And I was going to start really, really basic. This is stuff that I didn't know before I started thinking about farming, agriculture, land use, climate change, human health, nutrition, and public health until I sort of dove deep into really what the landscape of Iowa looked like. And it looks like this. This photo here, this map was admittedly a little bit dated here. I feel completely comfortable using it because not a lot's changed. This is what the landscape of Iowa looks like. And it's dominated by two annual crops, meaning that we plant them every year. They're not perennial. Yellow here is continuous corn, which means that it's corn on corn on corn on corn. Nothing but corn is planted in these spaces every year. Majority corn is this peachy color, which is really 5, 6. It's basically continuous corn here. Corn soybean rotation is in orange. Soybean corn rotation, which is essentially the same thing as a corn soybean rotation, is in green. And then other is, pasture. It can be woods. It can be just other land not being used for corn and soybean rotation. Maps like these very rarely change. This is what the landscape of farmland looks like in Iowa. They may go more or less corn, depending on the price that a farmer can get, that year was projected to get. But a market-driven agricultural system puts very, very little emphasis on soil health, ecosystem health, or other externalities that come from very intensive agriculture. Corn and soy make up 63% of total land area in Iowa and 82% of cropland. And many of you may know this if you're from Iowa or if you're, interested or have learned about sort of the land history of the state. But Iowa is one of the most transformed landscapes in the United States. From the prairie that used to be here prior to corn and soy, only like 0.1% of that original prairie exists. So it's a very drastically changed landscape, and it's mostly this what I call the other two-party system, right? It's just the corn and soy. I did want to give a little bit of background on what this term leaky crop means, because it'll come up when we start talking about nitrogen, nitrates in water and stuff. But what exactly is a leaky crop? And I'd actually be curious if any of you are familiar with the term leaky crop. I didn't learn about this term until I started delving into the agronomic research, but it's a crop that doesn't hold its nutrients very well. So a farmer will come and apply nitrogen to help speed the growth and encourage the growth of their crop. Corn doesn't hang on to that nitrogen very well, that synthetic nitrogen. So a lot of the nitrogen that gets applied to help corn grow doesn't stay put, and it washes away and in rain events and gets into water systems. A lot of that has to do with corn's root systems. They're very, very shallow. They don't do a lot to hold soil and nutrients, and also just has to do with the corn plant itself. But also nitrogen is very, very water soluble. It's not going to stay put for long. Plus, we're working with annual cropping systems. So we're planting new crops every year, and we don't have a very good root system developing. This is all going to be important later, but this is important background. Soy, on the other hand, you can't really tell from this picture, but the root systems are a little bit different, but it is also nitrogen fixing because it's a leguminous crop. It's a legume, so it puts nitrogen back into the soil, which is why we have these corn-soy rotations. If you plant soy after corn or before it, you have nitrogen being put back into the soil, which corn needs. Just some background. I'm sure as public health professionals, we are all very, very familiar with the water quality issues relating to agricultural runoff, right? I think that this is the point at which public health in Iowa and agriculture really meet pretty frequently. Fertilizers make things grow, right? And so we notice, I think on a fairly regular basis, things like what happens at the Mississippi River Delta, the hypoxic zone, these fish kills, issues with economics and recreation down here. There was a study done actually out of the University of Iowa that pointed to Iowa as contributing nearly 30% of the Gulf of Mexico dead zone to a single state, to us, with the nutrients that run off of our agricultural fields, which is pretty significant. But this is, and just to zoom out a little bit to the whole Mississippi River Basin, this is over a very, very large area of agricultural land, right? So Iowa is, of course, not the only state to blame here for this very, very obvious downstream problem. but it is something to keep in mind that we do contribute quite a significant amount. This water quality issue is not something that is only a downstream issue, right? This is something that's very, very close to home for us. This article was taken from the Des Moines Register from 2015. More than 60 Iowa cities and towns have battled high nitrate levels in their drinking water over the past 5 years. Evidence of contamination problem that reaches across the state environmental data shows. We're familiar with the Iowa Waterworks lawsuit. We're familiar with, keeping an eye on high nitrate levels in drinking water across the state. And I'm sure you all get your water reports through your city utility. It's one of my favorite places to go in the Cedar Rapids magazine that comes out to take a look at the water quality. And there's no we understand where nitrate in drinking water comes from. Very clearly states in our water quality report that this is an outcome of agricultural runoff. So again, this is where public health and agriculture most frequently meet. I do like to run through the impacts, how farming impacts water quality, both from a drinking water perspective, right, a city drinking water perspective, but also from a private well perspective. I think most of us are familiar with the EPA MCL limit of 10 ppm, parts per million of nitrate in drinking water, and that's mostly to combat, very acute impacts of high nitrates, blue baby syndrome being probably the most recognizable one. But there's research out there showing that, half of the MCL, around 5.4 parts per million of nitrates in drinking water, has been linked to more chronic disease, latent diseases, certain cancers, for example, that we need to be keeping our eye on and keeping, the MCL, I'm sorry, not the MCL, but nitrates in drinking water much lower than the MCL. Also, the Safe Drinking Water Act doesn't apply, or these MCLs don't really apply to private wells. So we're missing a fairly large population in Iowa when we are monitoring how those nitrate levels are impacting population health. I'll get into some more rural versus urban resources when it comes to water treatment plants, as well as protection and resilience against water quantity issues. But these are sort of top of mind problems. I keep using the word issues. I'm trying to get around the word issues. But these are the top of mind problems that come up as it relates to water quality and agriculture. As we start getting into water quantity problems, I like to show some pictures because I think that they sort of illustrate some repeating patterns that we see in Iowa agriculture. So, when we confine ourselves to these tight rotations, these 2-year rotations, or no rotation at all, if you're sticking strictly with corn, a lot of the soil's natural nutrients, you could say, the nutrients that had been built up over, tens and tens of years by the original prairie that was here. All of that natural nutrients in this black soil in Iowa, what Iowa is known for, this beautiful resource that we have, leaches away. And we're left with soil that doesn't hold water and other nutrients very, very well. In the fall, after harvest, we see a lot of bare fields tilled under, leaving the land very, very bare. Typically not a lot of cover cropping is done in Iowa, leaving a lot of soil exposed for when in spring we get our April showers that bring our May flowers. So here is a photograph of a rain event pummeling these little baby corns, these corn plants. But you can see already a lot of erosion and runoff taking place. These events will end up looking like something like this after the rain event is over. A lot of soil loss, and with soil loss comes phosphorus loss, and a lot of nitrogen loss, because where water goes, nitrogen will go. Nitrogen is very, very water soluble. Land use that is very that looks like this all across the state contributes to coastal, Iowa coastal flooding events that look like this. These are pictures that are taken from 2019 when Iowa was flooded on both coasts. I fondly call them both coasts. When the Missouri River on the left side of the screen swept away Pacific Junction, Iowa, and Dubuque and Davenport were hit really, really hard that summer, or that spring, I should say. I had the opportunity to go and tour Pacific Junction very shortly after this had happened, late in the summer, and the devastation was just completely overwhelming. I hadn't seen anything like this, and I had been evacuated from my Cedar Rapids apartment twice in the 4 years that I'd lived there because of flooding. This is a very, very acute public health problem, flooding events. And they are encouraged quite a bit by land use, building in the floodplain, farming very, very intensively, not allowing the soil to really be in a position where it can absorb the amount of rainfall that we're getting, and also to sort of mitigate against upstream flooding events coming downstream. Any questions so far? We're just feeling comfortable with content as we're moving forward. Okay, just wave at me, Brett, if there are any questions that pop up. I do like to include water quantity, particularly flooding, in the presentations that I give about agriculture, because, like I said, it is a very acute public health problem for many Iowans. And disaster recovery is something that I think we are all much more maybe prone to think about as a very distal, a very proximal part of public health practice. What does it mean when a town is hit hard by a flood? What are those public health implications? What does that do to mental health when you have to completely up and leave your home that you've lived in for who knows how long? What does this do for disease spread, access to care? Where do you get your dialysis if there's no power, if the dialysis clinic is washed away? Where do you keep your insulin if you no longer have a refrigerator? And what does that do to indoor air quality, the environment in which a person is living when they are able to move back into their home, if the home is still there? Maybe there are some healthy homes people on the call that are already shuddering violently at the thought of somebody having to move back into this home at the bottom photo here, right? I think as public health professionals, we are so much more prone to think about this part of, what I'm thinking of as downstream agricultural impacts, environmental health impacts, instead of thinking a little bit more upstream about maybe where some of this is caused, where those, we see maybe the source or contributing source of the problem. Okay. I said I would come back to sort of urban-rural discrepancies here, but when we think about which communities are hit the hardest, Pacific Junction, right? Completely washed away, absolutely heartbreaking. And we look at photos like this of Cedar Rapids immediately deploying the HESCO barriers, having a major disaster plan, being very, very resilient against these flooding events. We can see this huge difference in equity, right? Of the communities that are hit the hardest and are able to, defend against these natural disasters and bounce back. In Cedar Rapids, like I said, I had been evacuated from my downtown apartment twice. I felt like by the second time, people knew the drill. Everybody knew where to go to get sand for sandbagging. Everybody knew which streets not to use. It was slick. Everybody knew what was going on. It's not the case everywhere that flooding occurs in the state. So part of what I'm trying to weave into this point of the conversation that I want to have with everyone here is that soil health really is a part of public health, and agriculture really does impact soil health. Soil health being tied to public health, I really want to point towards the soil's natural water holding capacity and what land management can mean for downstream impacts and lessening those impacts. This slide here I keep for classes and for students, but I wanted to keep it in so that I could point you towards this publication by the Union of Concerned Scientists called Turning Soils into Sponges, where they look at particularly devastating flooding impacts. And the 2008 Iowa flood is in there. It looks at economic impacts and all of sort of the fallout there, but also says that changing upstream land management practices could result into up to 7% less runoff in the Cedar Rapids region, which would have meant 17% reduction in flood frequency if crop changes were implemented in less profitable croplands. This is just a fascinating read, and the summary is very, very short. I'd highly recommend anyone who's interested in maybe some more land-based upstream solutions and are interested in how agriculture, flooding, water quality, water quantity all intermingle. We can't really talk about farming unless we talk about pesticides, and this is actually a passion of mine when it comes to our work in farming for public health. So very, very briefly here, pesticides is an umbrella term. It refers to insecticides, herbicides, rodenticides, fungicides, really any compound with an active ingredient designed to harm or eliminate a pest. And each one of these categories has subcategories of chemicals with modes of action. So in insecticides, we have gone from organochlorine pesticides to organophosphate pesticides. We now use a lot of neonic insecticides, but these modes of action keeps changing. And so just knowing that pesticides does not refer to insecticides is what I'm trying to get at with this little section here. We use a lot of pesticides in Iowa. Over 50 million pounds of active ingredients are applied to crops annually. And we apply them together, right? There's a lot of tank mixes. There's a lot of, application of multiple different insecticides, herbicides, different modes of action. When we don't really know too much about the combination effects or the synergistic effects that these chemicals might play together. The other thing to know is that the EPA, unlike the FDA, does not, conduct their safety or their tests to evaluate human health and safety. Really, the EPA's role in pesticide label writing is to make sure that the compound does what it claims to do. So if it will kill a certain pest, that's what the label is. And the label being a legally binding document for how the product should be used and who should use it and how often and on what pest. I'm going through this very, very quickly, so shout at me if there are any questions now or afterwards. I am particularly interested in the harm to vulnerable populations from pesticide exposure, especially to children, which I'll get into here in a little bit. But there's a lot of evidence here, and that's very, very cursory. I can go back and take a, give you my lit review here. But there's a constellation of evidence out there that points to children being especially vulnerable to pesticide exposure, especially with this endocrine disruption piece. It's often marked as an emerging public health threat, endocrine disruption, though there has been evidence since about the 80s that this is something that we really, really need to be paying attention to. And pesticides often have a lot of hormonally active components to them. Of course, there are occupational harms, and herbicides and insecticides, their main purpose really is to eliminate biodiversity for the I'm missing the word here, but in order for crops to grow, we're trying to eliminate the competition. So it's eliminating biodiversity. And there are, of course, downstream impacts of eliminating biodiversity for human health as well. I wanted to just break down very, very briefly some of the herbicides that we use in Iowa. Acetochloroatrazine, atrazine being a very, very well-known endocrine disruptive chemical. And in the herbicide count, we use about 32 million pounds. Insecticides, I'm sorry, this is on soybeans, but insecticides, I wanted to draw your attention to this one figure from the 2018 USDA report that we still use about 200,000 pounds of chlorpyrifos in the state. Chlorpyrifos being one of the most well-studied, well-understood organophosphate chemicals that are incredibly harmful to child exposure and development, neurodevelopment. Lots of research there, and it's shocking to me that this chemical is able to be used at all, let alone so close to home. Which is sort of ties into my next section of my presentation, having to do with schools and their proximity to agricultural fields with all of this pesticide information in mind. We had some colleagues look at, put together a database of school proximity, Iowa school proximity to agricultural fields. And sort of, I'll go through their methods very, very quickly here, but the important part of these slides to notice is that from existing literature, we know that pesticide residues have been found in private homes up to a distance of 750 meters away. And being very conservative with that distance, that roughly is about 2,000 feet away. So when our colleagues were putting together this database, they were looking specifically at schools that were within this 2,000-foot drift radius. They found that 33% of Iowa schools, public schools, are adjacent to cropland, so just like this, maybe surrounded by or across the street from. And 90% of Iowa school buildings are within 2,000 feet of cropland, so within that drift distance. And depending on what's being grown and what's being sprayed, time of year things are being sprayed, this could be something that we as public health professionals should be at least keeping our eye on. It's significant because Iowa public schools before the pandemic were serving almost 500,000 students and employs almost 40,000 staff members. And at any given point, there could be some other family members, elderly people gathering at these school buildings because they are community centers, especially in these very, very rural areas. So this is part of some of my other work that I do at the center, specifically relating to pesticide exposure of very young children. But we're trained about this kind of thing, about vulnerable populations. Children are more vulnerable, both physically, physiologically, and behaviorally. They are in a position in all of these categories to be more at risk of exposure. And when it comes to kids, of course, that exposure is important, the dose, the amount that they're being exposed to, but the timing of exposure is much more important when it comes to pesticides because of that hormonally active component of them. Their early in life exposure really does set up their overall health for the rest of their life course that we need to be keeping an eye on. And there's a lot of public health evidence that strongly links neurobehavioral issues, including ADHD, autism spectrum disorder with early life exposure and in utero exposure. Links to cancers, to birth defects. I've already mentioned the endocrine and reproductive harms, and then also asthma, though I haven't quite been able to tease out if that's more to do with the development of it or an asthmatic trigger for some children. Questions so far? I did also want to point out that drift incidences, they're documented on the IDALS, the Iowa Department of Agriculture and Land Stewardship's website. The last year, the 2020 drift incidences are recorded here. Though I will say that that's likely an underestimation. These drift incidences have been going up, and we can talk a little bit about maybe why that might be and what chemicals might be drifting more, but I'll save that. I just wanted to put this on everyone's radar here. And now I'm flying through this because I really wanted to get to the happy, good stuff, the good news. I want to talk about some potential solutions and what action is out there that public health practitioners can really rally behind as being the upstream solution for a pattern of environmental ecological problems that we're seeing downstream in Iowa communities and much further. So there are some brilliant minds at the University of, or Iowa State University in the Sustainable Agronomy Department who ask very, very fantastic questions. Some of them being, can diversifying corn and soybean systems with small grain and forage crops, so things like oats, rye, alfalfa, reduce the requirements for purchased inputs, off-farm inputs, like pesticides, like other fertilizers, synthetic fertilizers? Can the diversified systems maintain or improve productivity and profitability? Can they suppress weeds effectively, reduce susceptibility to disease, plant diseases of corn and soy? And can they improve environmental performance characteristics? So you remember back to one of my very first slides, I had the map of an Iowa county, and it was really all just corn and soy. Diversifying a system, a cropping system, would mean adding more plants in there, having more crops. It wouldn't just be corn and soy, it would be corn, soy, and oats. It would be corn, soy, oats, and alfalfa. That's what that kind of system would look like. Oh, and actually I have a picture to maybe demonstrate that a little bit for all of us visual learners out there. So a 2-year rotations here, going corn, soy, alfalfa maybe, and then corn, soy, alfalfa, rye. And you can see with each of these rotations, a smaller part of the pie gets taken away from the other crops. So in a 4-year rotation compared to a 2-year rotation, you'd have to be growing less corn, less soy to make room for these other diverse crops. Okay, so what did these brilliant minds at ISU find? Well, they found that, of course, we're going to be diversifying the marketplace, because suddenly, instead of only corn and only soy on the market, there would also be oats, there would also be alfalfa. But most exciting and important for the purposes of this conversation is they also found a significant decrease in the amount of synthetic nitrogen required to grow these 3- and 4-year rotations. Down here, this reduction row is the most important row of this chart, and the one I want you to pay attention to. So in a 3-year rotation, so just adding one more crop to our corn and soy rotation, we get an 88% reduction in fertilizer requirements. Over 4 years, that goes up to 92. And herbicides, looking at all of these very hormonally active herbicides, we can reduce that by 96 and 97% respectively in a 3- and 4-year crop rotation. This is pretty groundbreaking and wonderful news. And these studies are long-term, they're still ongoing. But I bring them up, and I really want to spend a lot of time highlighting them, because in some conversations that I've had with public health practitioners, who work sort of adjacent to agriculture, the perception is that, well, conventional agriculture or intensive agriculture is conducted in the way that it is because we have to do this for yields. This is the best way to do it, and we sort of have to live with the consequences, the environmental health consequences of how we do it. But if we look at yields in these extended crop rotations, we see that profitability maintains. We maintain profitability, and we significantly reduce the amount of off-farm synthetic inputs. This seems like a win-win solution here. We're reducing environmental health burden, we are maintaining profitability, and we're reducing off-farm inputs, right? All very, very important things. So the way that that a lot of the land is being used in Iowa today does not necessarily have to be farmed in this 2-year chemically reliant way for farmer profitability, for all of the things that we maybe worry about if we do change the system. Okay. So to summarize the work coming out of ISU, diverse crop rotations lead to higher yields. They lead to significantly less amount of herbicides, 200 times less freshwater toxicity when it comes to that runoff, 88% less synthetic nitrogen, and half the fossil fuel energy with improved soil quality. And when we improve soil quality, we improve organic matter. And when we improve organic matter, we improve and increase water holding capacity, meaning fewer flooding events, or at least reduced impact of those flooding events. I do have a little section here about fossil energy. This amazing paper came out of ISU. It's an environmental science and technology that looked at diverse cropping systems, the impact on greenhouse gas emissions, and economic impacts of greenhouse gas emissions. So putting a dollar amount on agriculture contribution to climate change, essentially, but also including human health, because they looked at PM 2.5 and how human health is impacted in all of this. Really amazing. I'm not going to spend too much time on this, but just looking at these gorgeous charts gives you kind of an idea. And they didn't even do organic in these tests. So they were still using herbicides and all of these things, but found that increasing to 3 and 4 year rotations significantly reduced greenhouse gas emissions and also the economic damages from the greenhouse gas emissions, including human health. Okay. I also want to plug here the amazing work also out of ISU looking at reintroducing native plantings as either edge of field or infield plantings and how that can reduce water runoff and also soil loss. Maybe some of you have seen these pictures, maybe they'll be new for some of you, but planting just a little bit of perennial crops on the edge of a field can really reduce the amount of soil that's lost during these early rain events. And when we reduce soil loss, we reduce phosphorus loss because those two typically go hand in hand, and also slows nitrogen loss as well. Those deep perennial root systems can catch a lot of that nitrogen. And here are these deep root systems that I was talking about. The deeper the root system, the more water holding capacity, the more nitrogen filtration that we have. So these are really important natural, ecological, land-based solutions to some of these agricultural problems here. Bullet points that I can share with you later. I want to save a little bit of time for questions and discussion with you all, but really improving these ecological ecosystem services has so many more benefits than just holding soil, capturing water, capturing nitrogen. We're seeing massive increases in pollinator abundance, native bird species, insect richness, which all comes back to improving and including beneficial insects on the farm to sort of address pest problems without the use of chemicals, active ingredients. So Farming for Public Health is really a program initiative out of the CEEE that aims to educate, in particular, a public health audience about some of these land-based ecological solutions. This is a photo of that researcher that I was referencing earlier, Dr. Matt Liebman, Dr. David Swartney of the University of Iowa, Cheek, and our farmer friend, Ron Roseman, to talk about how he practices how he farms, and I was about to say how he practices public health. I really do consider a lot of these very innovative farmers, and I noticed that we actually have one that joined our call. Hi, Paul. These innovative farmers are as much public health practitioners as we all are. And I like to include them in these conferences. This was the Iowa Governors on Conference on Public Health a few years ago, to share their work and how they are making Iowa a better place, how they are improving Iowa's environmental health through their work. We also spend a lot of time supporting and facilitating on-farm field days that are hosted through Practical Farmers of Iowa, which offers these peer-to-peer learning opportunities for farmers to learn from each other about how they are implementing these ecological practices on their farms, to share their successes, their challenges, and to help each other move in this ecological, less chemically reliant farming practices. The tie here to Farming for Public Health is also, like, I wanted to put this slide here to when we're able to all gather together on these on-farm in-person field days, I wanted to extend the invitation to all of our friends in the Iowa Public Health Association. We really see these field days as mixers for farmers and public health professionals to engage and interact and learn from each other, since we're all interested in the same thing, which is a healthier Iowa. I didn't at all touch on animal agriculture as a part of this presentation. That could be a separate talk entirely. But I do want to sort of plug this fantastic blog post by Chris Jones out of the University of Iowa, Dr. Chris Jones, who put together this watershed based animal or intent, how many animals per watershed there are and their waste produced. It's a very funny and interesting read, but I just wanted to plug that here. And I wanted to leave plenty of time for questions because I went through a lot of things that I know I will need to clarify. So I will pass it back over to Brett to moderate all of that. But I really appreciate and thank you all for your attention.
All right. Thank you so much, Audrey. I I have kind of a question of my own. And if anybody else has questions, feel free to unmute and ask them or pop them in the chat. Um, so what are some places in Iowa that have gone to the a more diversified crop rotation system, less herbicide or less chemicals? What have been their experiences, and how has that affected um, more of like the day to day for them? I don't know, cost, yield, things like that. Sort of been their experiences with the more sustainable practices.
Sure. Well, I'm not a farmer, not a farmer anymore. I used to work on a vegetable farm, and I'm not an agronomist, and I don't run these large scale operations. I know that so the farmer that I showed a photo of at the Governor's Conference on Public Health, I think that was back in 2018, Ron Roseman. He farms a 7-year rotation, all organically, so no off-farm synthetic inputs. And he's been doing this for about 40 years now to maintain profitability, and I should say, and maintains profitability. I don't want to put anybody on the spot here, but Paul Muggy is an organic farmer in Sutherland, Iowa. He's on our call and might be able to shed a little bit more light on this. But I don't know the ins and outs or the book record keeping for these farmers. Just seeing through their practices, through their annual endeavors in this systems approach to farming, their success. There are definitely farmers in Iowa practicing these techniques today, and that are very, very successful in it. So I don't want to leave anybody feeling like, oh, this is just an idea that needs to be implemented later on the road. How do we do this? No, this is something that is being done today, and that I think we need to encourage, as I'm going to say it again, as fellow public health professionals.
All right, thanks. Yeah. I don't want to put anybody on the spot either.
Yeah.
Paul, if you'd like to speak, feel free. Otherwise,
Paul,
there he is. Hi, Paul.
Okay, you talked me into it.
There you go.
Matt Liebman's work is just incredible, and part of that too was the economics that even without being organic, the more diverse systems, the longer rotations work very well, comparable economically. And once you become organic, then you get premium prices for your crops. So then it works really well. I just have my little 300-acre farm, but I'm making a pretty good living on it, and I don't use any pesticides. So it's easy to say that I'm not contributing to the problem.
Mm-hmm. Thanks, Paul. I'm so tickled that you joined today.
Me too.
Yeah, thanks for coming. Thanks for sharing. Does anybody else have any questions in the chat? Or you can unmute and ask if you want. Otherwise, I have a list, but I won't necessarily get to all of them. All right, well, while people are thinking, I'll ask another one. You talked a little bit about health equity and the effects of all of this farming for public health on that. Mm-hmm. A lot of it had to do with location of individual schools, people near the coasts. Are there other health equity issues that this gets to, or anything, or maybe even a little more minute, anything with more background implications?
Sure. Well, yeah, there's a whole section of this type of work that very directly relates to the food system, and I haven't spent any time actually talking about food in this presentation that's exclusively about farming, right? I think baked into this talk are many layers of equity issues. One of them being food. So if I can zoom out just a little bit, I'm going to go back to my Pacific Junction, Dubuque, Davenport flooding examples. So the farming, the intensive sort of conventional farming system in Iowa is based off of these two crops, right? And when I was little, I sort of had this light bulb moment. I think we were driving down 380, passing all of these cornfields, thinking to myself, I don't eat this much corn. Who is eating this much corn, right? And I didn't realize until much, much later that this corn isn't for human consumption, right? Iowa has probably some of the most fertile soils in the world, and we grow on it a lot of things that humans can't directly consume, right? It goes into a much larger machine of this global food system, of animal production, of ethanol production, right? That it sort of takes away a lot of the efficiency that a calorie maybe grown in Iowa's beautiful soil would have if it was growing food that like a person could eat, right? And baked in there are a lot of policies that encourage, or at least maybe a better way to say that would be discourage some of the practices that are more ecologically sound and friendly. So this is very roundabout. I promise that I'm getting to where we need to go with this. So when we think a little bit more about the food system and how cheap our food is, you know, I should just pull up that photo again. There is that photo of the gas station in Pacific Junction. You know, you can drive by these gas stations and see advertisements for 99-cent dozen eggs, right? But lost in translation are all of the externalities upon which that cheap food is based, right? Those eggs can be so cheap because we farm so intensively, you know, on a very, very broad scale. So when somebody at Pacific Junction goes to a gas station or a convenience store to get a dozen eggs for 99 cents, the fallout, you know, the externalities of a flood isn't captured in that price, you know? And I think that that's inherently an environmental justice, a food systems issue. That so much of our current practice and how we treat the land, how we interact with the land, you know, what consumer signals are sent that it sort of encourages the way the food system is set up. It has no economic signals to say that we should be doing anything different, because a flood does not seem at all connected to cheap food. And it's a very difficult connection to articulate concisely, but these things are very, very related. We don't have a good way of capturing these externalities of a flood, of cheap food, and putting them together in the same equation, right? And Iowa, the Midwest, the Corn Belt, is really ground zero for a lot of these things. This kind of thing doesn't happen in other places in other states because their soils aren't as fertile. And they're just not able to farm the way that we can here. So these things are unique to this region. And I think that public health professionals, especially those of us who are in the Iowa Public Health Association, we sort of have this, I don't know, responsibility or this, I think, this pull to be addressing Midwest or Iowa specific problems. And I think that this is one of those that sort of flags itself as being very like, this is here, this is home, this is something that we can talk about and address. I don't know, that was very, very roundabout. I did a lot more talking than I should have to answer your question, Brett, but there's my answer.
Oh, thank you. That was really helpful. That was more than I would have thought of. And that's, yeah, I like to hear all of those roundabout details. Thank you very much. Lena's put a good question in the chat. She says, I was urbanizing and more people are moved from farming as an occupation, but getting into more urban gardening. What should those of us in urban settings consider when it comes to our own gardening or lawn care?
So glad you asked, Lena. So I got my start at the CEEE managing a program called Good Neighbor Iowa, which is all about reducing, abating the amount of unnecessary urban herbicides, mostly urban pesticides used for cosmetic purposes, for the sole reason of child protection against these chemicals, right? And so I would really encourage folks who maybe feel a little bit more distal from some of the topics that I spoke about today when it comes to agriculture, to rethink how we are treating the land closest to us. You know, really rethinking using those chemicals on our turf. Does that really need to be done? What changes in the, you know, backyard ecology that might be beneficial? I often encourage folks to be a little bit more welcoming towards small, diverse flowering plant communities, aka weeds, in our lawns, because they are such a source of it's a biological hotspot in an urban environment. If, for example, you have dandelions in your yard, urban bee populations are typically very, what's the word? Singular. Like, urban bees don't really live together in a hive. They sort of live in isolation in the soil. And so when we like leave them things to forage, they're a lot happier, and we're very, very reliant on pollinators. We're in a pollinator crisis right now, globally, but also in areas, especially in areas that use a lot of chemicals or have a lot of environmental pesticide drift, which is where we are. So I would just encourage folks to rethink how we apply or use chemicals in our day-to-day urban lives.
That's a very good point. Having lived in an urban setting my entire life in the middle of Des Moines, that's not something I personally think of on a very regular basis, and I think that applies to a lot of people. You think of it more as a rural farming issue when it can apply everywhere.
Right, and I think I'll just jump in really, really quickly. A lot of the chemicals that are used in an agricultural setting, things like we're very familiar with glyphosate or Roundup products being used on the farm for GMO crops, or Dicamba. It might be something, a phrase or a name of a compound that you may have heard in the news from all the Dicamba drift last summer. Dicamba, glyphosate, these are things that are 2,4-D. These are things that we also use on our lawns. You can buy them at a Walmart, at a Home Depot, at a place to do your broadleafed herbicide treatments for your lawn. And I think that might come as a shock to some people. The things that are used in a very commercial, I think would be an okay way to say this, a commercial scale on a farm, on a very, very large farm, you can put in your backyard. And I don't know if that makes too much sense to have some of these. And they're usually applied in an urban setting in much more larger concentrations than they would be applied on the farm. Volume wise, of course, agriculture is going to have more herbicide, insecticide, but concentration wise, it might even be higher in an urban environment just because of how we're applying it. So.
Yeah, thanks. That's a good parallel to be aware of, and I certainly have not been, and that's something to definitely think about for those that are in a more urban setting. Does anybody else in the chat have any other questions before we wrap it up and move on with our Thursday?
I might make one other comment if I could.
Please, Paul.
Audrey, when you were talking about the connections between our food systems and the flooding, there are at least a few direct connections there. One is that we have spent the last several decades, farmers have been encouraged to straighten cricks, for example, so to make them easier to farm. And one of the goals for that is just to get the water off the land as fast as possible. And that contributes to the flooding. Also, because of the fence row to fence row planning, all of the wetlands that used to store a lot of that water upstream have been plowed up to plant corn and soybeans. And the third thing is that as we've decreased the amount of soil organic matter in the soils, the water infiltration is lower, so more of it runs off and less of it is being stored in the soil. So, a couple.
Thanks, Paul.
No,
there's so much there. There's so much there. We just need to have a lunch and learn that's exclusively farmers to unpack a lot of the things that I very cursory try to touch on. I really appreciate it.
Yeah, that would be a fantastic lunch and learn. All right. Yeah. Thank you, Paul. If nobody else has any other questions, if you do, put them in the chat or unmute real quick. Otherwise, I think we can wrap it up. Thank you, Audrey, and thank you, Paul, for your input as well. Thanks for sharing your expertise today, and thank you to all of you who came and shared your lunch with us. Next month, I hope you can join us again. It'll be on the 15th, where you'll learn about partnerships between libraries and public health. So something else you might not often think about. The Education Committee is still planning topics for the next season of the Lunch and Learn starting in September. Welcome your ideas to showcase your or others' work, and we welcome anybody with an interest to join the committee. As a reminder, IPHA is a nonprofit and relies on membership dues and sustaining donors to support our mission. If you're already a member, thank you. If you're not, please consider joining. If we have any students in here, you can check with your department chair. Some programs have funds to support your membership. We appreciate any donation that fits within your budget. You can join and give at iowapha.org. You can also find the recording of this or other Lunch and Learns, any other webinars will be archived on our YouTube channel, Iowa Public Health Association. So I think that's about it. Thank you all for coming, and see you next month, hopefully. Thanks, Audrey.